Hi, I'm Dr. Whitcomb. Uh, Thank you for joining me today for our first, absolutely my first uh, public event going live. I really appreciate that. Today, I'd like to talk to you a little bit about fibromyalgia, also a little bit about trigeminal and complex regional pain syndrome, which is also known as RSD. We came about the trigeminal and the RSD as a secondary effect to our treatment with fibromyalgia because so many people who had fibromyalgia also had RSD and trigeminal neuralgia, and we saw a really good response with those conditions along with the fibromyalgia. And I'll explain more about how that works as we go along. Before we get started, I'd like to ask you a question. When you think of a hero, what do you think about? Maybe an athlete, um, a good athlete who has a good reputation, who helps your kids be better people. And I think that there's some real good to that. Maybe even a movie star has some good virtues. But let me take it a step further. If we think about a prisoner of war who is sacrificing his life defending his country, who gets captured, I think all of us could agree that that could be a really good example of a hero, especially if he goes through all of that with honor. Anytime someone is captured, every country knows that the worst form of torture is rejection. And so they try and set them up where they have rejection by their own people. And not only that, but by their captors. Oftentimes they have sleep deprivation, torture, which is a big part of trying to get information and trying to make their life miserable. And many times these people who are suffering from torture, sleep deprivation, anxiety, depression, being away from their families, would rather be dead than alive. But they don't die because they want to someday be reunited with their family and be with their family. What I would present to you is that a fibromyalgia patient is much like a prisoner of war. Maybe they're not captured and they're in a foreign country, but many times they have sleep deprivation. Oftentimes they're rejected by their own family members, by their doctors, they're rejected by friends, and many times they're just treated like they are drug addicts or alcoholics when only thing they're really trying to do is get through the day. So if you look at that as suffering in many ways with the rejection, with the pain, with the torture, the horrible torture of pain, the anxiety, depression, irritable bowel syndrome, I think that in many ways they suffer just like a prisoner of war. And most of them that I know of would rather be dead than alive, but they stay alive because they don't want to hurt their families. And they're hoping that one day they'll be alive, physically, alive and happy again so they can be with their families in a way that they used to be and restore their marriages. So I think that fibromyalgia patients are heroes. They're heroes to me. I understand what they've been through. I had it myself, spent years in bed. It's not an easy thing, and time doesn't go fast when you when you have fibromyalgia. So I don't know why people have to suffer so much. I know maybe some people would say that some are counted worthy to suffer. I really don't know. Maybe it's time and chance. Most fibromyalgia is created by trauma. And anyway, let me explain a little bit about my first patients. The first patient I ever saw that I think had a really bad case of fibromyalgia was in 1980. And I saw his wife. She came in and said she had had migraine headaches, but she was curled up in a ball in the chair when I came in. Nobody does that. So I asked her, I said, what's really going on? She said, my husband. So he sits at home. He's been institutionalized twice. They're talking about doing it again. He sits at home and he wrings his hands. When the neighbors come home, he starts sweating and shaking. And he used to work for Rockwell International. He was fine, and now he's terribly ill. So I took care of her and helped her with her headaches. But in the meantime, I had her ask her to bring her husband in, and he came in, and sure enough, he was just like she said. And when I evaluated him, I found he had a really bad upper neck problem. So I decided to work on him and correct the upper neck problem. But to my surprise, he actually got well. His symptoms went away completely. And that took about a month. And then the next month, he spent a full month with medical examinations that Rockwell put him in. And at the end of those evaluations, they said, you're normal and you can go back to work. Shortly after that, I got a call from his psychologist who said, I want to know how you cure paranoid schizophrenia. And he took me to lunch. I explained to him the situation. But to tell you the truth, I didn't really know what I did, nor did I know how to duplicate it. I know that I worked in the area where the problem was. And after that, I saw quite a few people who were in car accidents. Oh, I don't know how many. I've probably treated 5,000 people in car accidents. And many of them would have fibromyalgia symptoms in the beginning after the car accidents that would remit with treatment. I think a lot of those probably would have remitted without treatment also. It was just the initial stages, but somehow it triggered something in my mind years later in 2002 when two patients came in that were in a bad car accident, and both of them had severe fibromyalgia to the point of severe confusion and so forth. And I thought to myself, everybody says that fibromyalgia is a combination of stress. It's a combination of trauma, maybe toxic environment, and all those things come together and create fibromyalgia. But I thought, I've seen people with these symptoms that didn't have the other things. They just had trauma. So I thought, you know what, if it's coming from trauma and they're having full body pain, they're having head issues, some of them vision, hearing, and all kinds of different things, said it could only be coming from the upper neck or the brain. I had MRIs in these patients and the brain turned out good. As a matter of fact, they cleared them on everything, except I could see that there was a significant compression up on the upper cervical spine into the meningeal area. So I took the MRIs and I went over to a friend of mine at the hospital who's a radiologist, and I said, I think we might have a fibromyalgia issue that's caused by a constriction on the meninges. What do you think? And he said, we don't have any training in this, so I have no idea. And so I thought, well, there's another dead end. So I went back and I developed a treatment to work with these patients, and they got well. They actually got well relatively quickly. From there, other people heard what had happened. And the next I saw a woman who had been shut in for 18 years in a trailer. She came in disheveled, kind of haggard, bent over, dirty. She obviously had not been bathing. And so I evaluated her and I treated her in a similar way as I did the other patients. And 2 weeks later, I walk in and she's sitting in my front room crying as hard as anybody I've ever seen cry. And I said, what is wrong? And she goes, it's not wrong, it's right. She says, I'm back. Said, I have been gone for 18 years and I have hardly any recollection of what happened for 18 years. I've just been, and she said, I'm here again. And now all of a sudden I'm getting excited. I realized I found something pretty important. At that point, to tell you the truth, I thought, this kind of finding will probably get me to lose my license because it's just too big, too complicated, and it carries with it a lot of problems. Anyway, I thought, I've got to continue with it. How could I not? So from her, we had another patient come in who had been a Vietnam veteran. He had 3 terms, Delta Force, breaking people out of prisoner of war camps. And they would slam him in the back of the neck because he got captured over there with rifle butts and put him in a hole for long periods of time and bring him out to torture him. And he eventually escaped and took some people with him. Well, that was another person who was doing well. He was very difficult because of all the neck damage, but he did well. And then after that, we thought, well, we need to reach out to people. And so we did. And the practice grew and grew until we were just overwhelmed with patients, and almost all of them came from other states and other countries. Now, in the beginning, I thought it was one thing and only one thing, and that one thing worked almost every time. But to tell you the truth, a couple people got worse. And those couple of people created lots of problems for me later on. And then it's even after that, it took me another year or two to figure out that I had a test I could perform to find out how to treat the patient before we started care. And the test for most of the people, almost always, or I'd say mostly, 50 to 100% of the symptoms would disappear during the test in the first 5 minutes. So we thought, if this doesn't work, we don't want to waste people's time and money, especially if they're traveling. So we made the test free. We don't charge for the test at all. And so if you come in and get tested and you have a good significant decrease in your symptoms, we know ahead of time that you should respond to care. Not 100% of the time. I've seen patients with so much neck damage, that they would respond and then they go back, or they wouldn't respond at all. But with the test, if it works out, we know that they should respond, and we'll treat them. If they don't respond to the test, we'll try and find out who can help them and send them over to someone else. So the test was amazing, and that stopped the difficulties of people who didn't respond well to care. Not 100%, because like I say, some people I had one guy from Chicago, and I worked on him and worked on him. He responded great to the test, but he had such severe damage to his neck and ligamentous damage that just wouldn't hold, and he would revert back. He understood. He was a really nice guy. And so on and on. Most of our patients would be with me for a couple months. Some people would be a little longer, some people only a month. But anyway, I have statistics I'm publishing on my site here, and you can go ahead and take a look at those and download them. It's hard to print because it's 200 pages, but it shows the average of what every patient, the reduction in symptoms, and this is something they filled out. It was very extensive, and you can see every symptom they had and how much better it got with that, and I'll go ahead and publish that. Now let me explain a little bit more about what causes fibromyalgia. You remember in the beginning, I actually thought that the bone was resting on the spinal cord, but it wasn't, and we looked, it was actually on the meninges. The meninges can be compressed in different ways. In the beginning, I thought the meninges was only being compressed from the back, and that would create symptoms that I know now that are more in the head, in the shoulders, in the arms. It can go down full body into the hips. Most of my patients, when it gets into the hips, they're disabled at that time because they have so many other symptoms too. And so, and then if it moves the opposite way, it puts pressure on things like your optic nerves, on your trigeminal nerve, on nerves that go into your face, and you can have terrible facial pain, terrible teeth pain. I had one woman came in and she'd had her teeth pulled out. They hurt so bad. And she would just sit and hold her mouth because it just made it worse. It didn't get any better. The trauma of it made it worse. And she responded very well to care. So it can affect the face, and if it moved one way. I've seen patients go blind. I had 2 patients during my testing, they got their sight back. I had a couple patients who couldn't speak. You can actually look on my videos and find those. One of those, you can see her get her speech back, as I test her. So speech, eyes, hearing, it can affect a lot of different things. But most of the people don't have that facial problem with the eyes and the speech and so forth. They have the other. Now, doesn't matter which way it goes, it almost always creates anxiety, depression, fatigue, insomnia, irritable bowel syndrome. It can create restless leg syndrome sometimes. Almost all my patients are on anti-anxiety, antidepressant, and heavy, heavy pain pills. Now, you can have a light case of fibromyalgia, and you might have somebody at work who's grouchy. Maybe they like to have their shoulders rubbed. They're difficult to get along with because they're usually tired and worn out, and you can barely make it through the day anyway. And then the severe cases, they're at home all the time. So let's look at it like this. Your brain has nerves that come off of it, that most of those go, a lot of them go into the head and so forth, but a lot of them go into the spinal cord, and that's where your arms work, your intestines work, your legs work, your different organs and so forth function from there. They have to go through the covering of the spinal cord, which is called the meninges, and that's what we've been talking about. If you put pressure on the meninges, it raises it, puts pressure on the nerves, and the nerves fire all at once. You can have a little pressure and kind of create up here in the neck and maybe the shoulders, or a lot of pressure and your whole body can hurt at one time. And so many of the doctors, actually it's in my neurology book, if a patient comes in and their whole arm hurts, that's called oh no, I just forgot the word. Neurologic hysteria, if I remember right. Anyway, they say the patients they have hysteria. They're a little crazy because it affects the whole arm, and that's not possible to do. And it isn't if you're looking at disc herniations or other kind of spinal problems. But if you have a meningeal problem, it can not only affect the whole arm, it can affect both of them. It can affect your body, and then it pulls on so many nerves that you go into sympathetic. Sympathetic is your sympathetic mode is fight or flight. It's made for you to be able to have extra energy, the adrenaline pump, you're wide awake. And when the lion comes in the door, you go into sympathetic, into terror, and you got this like strength to run fast, to do whatever you can, fight the lion if you can, I guess. But the sympathetic mode turns other things off. Your heart rate goes up, your blood pressure goes up, but it turns your intestines off. It's not time to digest food. It's time to be on alert. When you're alert, guess what else you don't do? You don't sleep well. So my fibromyalgia patients live in this anxiety. They don't sleep well. They don't digest food well. Mostly they have diarrhea, sometimes constipation, and sometimes alternating, but the intestines aren't working well. You don't need much of a sexual drive during this time either, and usually that shuts down. And so that explains really well why a lot of fibromyalgia patients just aren't really very sexually active. Not only that, but oftentimes it hurts. So if you're married to someone who has fibromyalgia, this is a really good explanation of why they don't really feel like they have much interest in sex. And oftentimes, they may, but it's probably not enjoyable and oftentimes very painful. Is it hard to be married to someone with fibromyalgia? You bet. It's much harder to live with it. So that gives you a little bit of idea of the symptoms and why you have the symptoms you do. Sometimes you'll get this action potential and your leg will jump. You'll be trying to go to sleep and your leg jumps and wakes you up, and it's just involuntarily jumping. Not all fibromyalgia patients have that, but a lot of them do. But almost all of them have the irritable bowel syndrome, the anxiety, the depression, the fatigue. It's very, very difficult. So now let's talk about what that does to your friends. Your friends come over and you go, oh, hey, it's so good to see you. Thanks for stopping by and see me. I'm getting kind of lonely around here. And they come by, they go, hey, let's go out and get a bite to eat or do something. We'll go to the park. And you go, oh, I'm so tired. I didn't sleep last night. I got like an hour's sleep. So they go, oh, I'm so sorry. And then you got to go lay down and they go home. They don't come over very many times until they just get so uncomfortable. They don't know what to do. They just quit coming. They quit coming. They quit calling. Pretty soon you're living by yourself. I have seen the most wonderful family members that doted over the fibromyalgia patients. I have seen the worst family members who are mean to them. They don't believe them. They think they just want drugs. They think they're lazy. They think they're complaining. It's a horrible thing to live with. And if you happen to be married to one of those people, please have them watch this so they can get a better idea of what's going on and maybe have some empathy. I had this one patient. She was, I think, 10 years lying in bed in Hawaii. She always wanted to live there. She's on one of my videos. And she'd get called by her friends and her family, but she would never answer the phone, nor would she return their messages because she was just too sick. I was speaking in Nashville, Tennessee, and her family lived there, and they came to one of my talks. And this is after she had she had responded well to treatment and went back home and called them. And so anyway, after the talk, they came up and told me who they were and that they would, glad that I'd treated her and helped their daughter. And I told them, I said, your daughter thinks that you're mad at them, you're mad at her because you don't call anymore. And she's afraid that you think that she's mad at you because she doesn't respond to your care. I said, she's too sick to answer the phone, too sick to call back. And excuse me, they just broke down and started crying because they had no idea that she was actually that sick, and they had been a little remiss in not going to visit her, take care of her. If you have friends that have fibromyalgia, don't stop visiting them. See if you can call them. Call them every day. Give them some encouragement because it is a horrible disease to live with. Most of my patients have told me they'd rather have cancer. They said, if I had cancer, I'm either going to get well or die, and I would rather take a chance on that than to live with this for the rest of my life, just being absolutely miserable and not being able to take care of my family and do the things I used to love to do. Well, I had actually a dear friend today, even to this day, and she'd spent 12 years in a wheelchair, and she had a buddy that also had fibromyalgia. She was so sick she couldn't figure out where the forks went in the drawer. When she came in, she had to lie down for me to talk to her, and she, and she had lived all of these things, but responded really well to care. Today she's working. She's been well now for, I don't know, 13 years. And she, within like a week or two, she was up and walking. Now, my patients walk 3 to 4 miles a day. I don't care if you come in a wheelchair. Usually my wheelchair patients are walking within the first week. The patients who are having convulsions as another symptom, usually they disappear the first week. And I require that they walk 3 or 4 miles a day before they go home. So this is the thing. You walk 3 or 4 miles a day and you're 90 to 100% symptom free for at least 2 weeks, so you become stable enough to go home. And then I train you and your family on things you can do to keep you well so you don't end up getting sick again. Most of the time, chiropractors have been trained to do things that makes it worth, I would say 2/3 of the time what they do to you will actually make you sick again. So that's difficult. If you really need to see a chiropractor, have them call me. I'll tell them what to do. See if they'll listen, they can help a lot. But mostly what we can do is we can get family members to do things to help you so you can stay well yourself after you go home. Let me see here if I missed anything. Oh, causes of fibromyalgia. Trauma is typically the major cause. Trauma by car accident is number one, but trauma also from surgeries, from having your head in that position. Many of my patients actually came out of their surgery in horrible pain that didn't go away. I had one woman from Texas, and she was a teacher, and she came out of a hysterectomy, and she had so much pain. She had so much pain that she literally was screaming in pain, and she ended up in a wheelchair, and she taught, I don't know, 12 years more from a wheelchair, with fibromyalgia. And she had a knee replaced. She had she was supposed to have both of them, but she had the better knee replaced first. And then she came to see me before she had the worst knee. But when I treated her, the knee pain disappeared and she didn't have a problem there. And she went home well. She was tenacious. She fought for her health. She'd do anything. And she was amazing. I love those kind of patients. Every once in a while, I get a patient that really doesn't want to get well. That makes me very sad. But I understand sometimes getting well, the hardest thing about getting well is going home. Because many times the spouses will say, well, you're well now, let's go back to work. You are mentally not able to deal with that. At least most people aren't. And so when they go back home, they need to work back into things gradually because they are entering a world that they haven't lived in a long time. They've been under heavy medications. Most of my patients during the course of their care are able, with their doctor's help, to get off of about 80% of their medications, and that's not with heavy withdrawals, because medications, everybody thinks you're taking all these medications, you're just loaded out of your mind all the time, and that's not true. If you take too much, yes, you will be, but the pain eats up the medication. The pain opens up receptor sites, and these receptor sites cause pain. So when you take the medication, it fills those receptor sites. When I close the receptors by reducing the compression, the pain gets better. You need to be tapering off, because if not, you'll be taking too much. You need to check other things like your blood pressure to make sure your blood pressure, because oftentimes people will be taking high blood pressure medication. When it drops back down, when the sympathetic stops, that blood pressure, drops also, and they oftentimes have to reduce their medication. I've had many patients call me and say their thyroid started working again. That's a really big problem. And we tested hundreds of women and men, testing their hormones, and I sent them over to a friend of mine's office, and he used to test their hormones because he had a lab there. And he called me up one day and said, "Do you realize these patients don't have any testosterone?" I go, "Well, what are you talking about?" He said, "They don't have testosterone. It's just tanked in all of your patients." Those hormones get affected by nerve impulses also. That's a really, really big deal. The pituitary gets affected. So yeah, you can have so many different things, but physical trauma, surgery, mental stress, and genetic predisposition, that is, in my estimation, most of that is just small tolerances up there. With those small tolerances, it doesn't take very much to give you fibromyalgia. And so some people just don't have as large openings as other people, and it becomes easier for them to have fibromyalgia. I've seen patients just have one side affected, and only half their body have fibromyalgia, and the other half is just fine. There you go. Usually what has happened, there's a rotation up there that we need instead of a movement, forward or backward. Nutritional health. So many people have said they take nutrition and it helps their fibromyalgia, and that's true. That's absolutely true. I don't believe that's a cause of fibromyalgia, but they get a lot better, and here's why. Because they've got diarrhea, and they're flushing their nutrients through before they get absorbed. So if you're really hitting the nutrition hard and eating better food and staying away from the toxins and everything works better, and you do feel better with nutrition. Exercise usually makes it worse. You can go out and walk all you want. That's not going to hurt your fibromyalgia, but if you're bouncing and you're lifting weights and pulling on your neck, it's going to get worse. My technique is a technique that's essentially painless. It's not necessarily terribly comfortable, but it's not that bad, and the treatments last about 5 minutes, and they work very well. I used to do some pretty heavy adjusting with my patients, and I found that I can use some different types of trigger point therapy and pressure techniques that work just as well as the adjustments, and they're not as traumatic, and I think they actually work better that way. So that is what I switched to. Some of the do's and don'ts if you have fibromyalgia, and also things for during your treatment. Putting your head back usually sets it off. People put their head back in the showers and have a flare-up. They hang their curtains, they paint their ceiling. Anything where they have to put their head back for any length of time seems to be bad. Put a pillow underneath your neck and putting pressure on it, for about 2/3 of the people, makes them sick. Some people get away with it, but not everybody. Let's see here. Lying on your side with a pillow just keeps your head straight, so you're in about the same position you are like this. Usually is pretty good. You want your head to be neutral. You don't want it being pushed over one way or the other way, or way back. Oh, dancing, bouncing, all of those type of things. When you go home, we also have you abstain from a lot of these type of exercises until things tighten up and they're good and strong. Most people can go back to full exercise. I had fibromyalgia in 1988, lasted about 5 years, 2 years in bed, but it was caused after some really severe trauma and stress and a whole lot of things. And surgery, if you had fibromyalgia, try to avoid surgery as much as you can. If you need to have surgery, you can also have your surgeon call me or the anesthesiologist, and I can help them a bit with that. But primarily what I would tell them is pick your head up every few minutes, move it around, set it back down. And so it's not just stuck there for hours with that pressure on the back of your neck, pushing everything out of alignment. I had one of my patients, the anesthesiologist and the surgeon were talking in the room, and they said, "This crazy woman thinks surgery can cause fibromyalgia." And they're laughing, right? They didn't know she was still awake. And she sat up and she said, "And it can. And you guys, it's not funny." I got kind of a kick out of that. Oh, there's a couple complications to treatment. Medications can be a complication in that a lot of patients get so used to them that they like them. Maybe they abuse them a little bit. That creates some complications for me. Usually those patients will say, well, I'm not going to quit taking my medication until my doctor takes me off of them. Usually that's, and I agree with that, but I just want them to call their doctor and let them they're doing well, or see one of our doctors. Oftentimes, we'll have doctors we work with or a doctor in the office to help get our patients off of medications. Attitude and everything makes a difference. My patients who are set on getting well do better. The ones who are just there because somebody made them come, they usually undermine their treatment before they go home. Then they go home and say it didn't work, and then their husband's mad at me. But that happens. Arnold Chiari malformations is it's kind of like a herniation of the cerebellum that gets into the magnum and creates extra pressure. I've had that before where they responded really well to treatment, and then once in a while where they don't. Depends on how large it is. Sometimes those need to be taken care of surgically. And some spinal stenosis in the upper neck can create similar problems as well. Usually the symptoms are a little different, but they can be very, very similar. Like I say, most of our patients are seen for a month or two, sometimes 3, really severe cases, sometimes 3. I have a patient, and I don't know why my patients become dear friends, because I spend so much time with them, get to know them, and we recover together in so many ways. And his name is James. He's from England. He's probably watching right now. And what a great guy. James was very, very sick, been sick for 28 years. I mean, he couldn't dress himself. I mean, he's really sick. And I called him a couple of days ago and talked with him. He's just the best of people, and I just love him so dearly. But he was there 3 months, and we worked and worked. It was a difficult situation. And people say, well, I take you off your medications. I don't take people off their medications, not my job. The doctors that put you on the medication should take you off as you get well. If they don't, we'll find somebody to help you with that. Oh, okay, here's the big one. The effects on relationships. It's so difficult for, significant other, your spouse, to live like this and to see them suffer so greatly, and then to see nobody have any help. Everybody out there has something going. They got this herb that's going to help you. If it's network marketing and they're selling it for fibromyalgia, people make a lot of money off of selling stuff. Usually that's, like herbs and network marketing and stuff. It might have some help. I'm not against trying stuff. It's just that most of the time that stuff just doesn't help any more than what we talked about earlier. And it can be good as far as nutritious, but it's not the cause. And this is all my beliefs. This is my work. You can look at my studies and see how I've done with it. The 200-page study I'm going to send you, by the way, I had people list every symptom they had, and a lot of them weren't fibromyalgia symptoms. So The overall numbers are down a little bit, but they're still so significant. I've never seen any studies anywhere where anybody had even close to the results we have. So when you go home, what are you going to do? Go out and dance. Go play. Play with the kids. Have some fun. Do all those things you wanted to do for a long time, and just go enjoy yourself. Do something new. You know, a lot of my patients go home and they hate their homes. They don't realize they were so dark and dingy, so they open up the windows, open the curtains, they paint the walls, they'll redecorate. Sometimes they sell their furniture. Sometimes if their husbands were mean to them, they divorce them. Side effect of getting well, I guess. Anyway, go on vacation and have some fun, enjoy yourself. If you want to go back to work, start part-time. See how you do. Work into it gently. I remember when I was going back to work, every day, everything in me says, don't go there. You know, you're going to die if you go there. There must be something there that made you sick. And it was so difficult to get back into going to work again after being sick for so long. And I don't think that that's unusual. It's a natural aversion response, especially if you worked sick. We talked already about, you know, your fibromyalgia patients. One of the things you can do the best to help fibromyalgia patients, subscribe to my channel and then tell your friends about it. Put a like on there. All of those things help my ratings go up where more and more people see me, and I can get the word out to more and more people, and that helps. And please tell your friends. I've got lots of videos on here you can watch right now, but also I'll be doing these live events at least 2 or 3 times every week, and answering questions and going through things and new information all the time. So I feel overwhelmed with the magnitude of the responsibility of having this information and getting it out. You know, we used to travel all over the states and travel and teach and you know, and then I had a couple doctors helping me see patients. And recently, my wife passed away about 4 years ago, and I just during her illness and during the, you know, years since then, I've been kind of out of duty, to tell you the truth. I'm back. I'm feeling good. Like to help some people. We got a little bit of wait before people can get into the office, but if you're interested, call as soon as you can and we'll help you. And in my bio and the other videos, we've got contact information, phone numbers, and that type of thing. Anyway, thank you. If you've been with me all this time, thank you so much for listening, and I really appreciate that, and God bless you.